So what are the objectives? Is to demonstrate the rationale behind the use of ultrasound for spinal interventions, use of ultrasound to visualize the different spinal structures, what's the evidence, why do we need to use ultrasound, and advantages and limitations of ultrasound image guidance for spinal interventions. So let's start with the cervical spine. So cervical spine, sononatomy, those who use ultrasound probably would be familiar with it. C6 has anterior and posterior tubercle. C7, there is no anterior tubercle. I call C6 as a ghost and C7 as a lounge chair. What I mean by this is here, if you sit this bit here, you have got the anterior tubercle, you've got the posterior tubercle, and the nerve root sits in that area. And if you look at the C7, there is no anterior tubercle, only posterior tubercle. So if you look at the bony outline, it looks like a lounge chair. So just putting all together, so that's basically C6, anterior tubercle, posterior tubercle, and C7, you only have posterior tubercle. So in terms of cervical spine interventions, I'm going to tell you about stellate ganglion, cervical nerve roots, and cervical medial branch. So stellate ganglion, won't go into too much of details, but we know this is basically a ganglion situated at C7T1 level. And when we use ultrasound, we don't do stellate ganglion block. We do middle cervical sympathetic chain block, and the local anesthetic spreads down, and we eventually get stellate ganglion block. Now, this was basically a validation study that was done by my very good friend and my mentor, Anuj Bhatia and Mike Goffel in Toronto. And what they did, they used ultrasound and they injected a methylene blue dye and they dissected the cadaver. And they saw a nice spread of the methylene blue around the cervical sympathetic chain.